Hello, everyone. Thank you for joining in to listen to my research presentation. For my research topic, I chose to focus on robotic surgery and its relationship with the impact on individual outcome. What is robotic surgery? To dive in, I'm going to provide a brief introduction and description. I consider this research to be a thorough analysis on the impact robotic surgery has on individual patient outcome and surgeon outcome and performance. My research question is whether individuals agree or disagree with the use of robotic surgery. My literature and research focused a lot on summarizing several studies of robotic surgeries for different types of ailments. I focused on several key points throughout this research, but some of the key terms I chose for my topic are robotic-assisted surgery, which entails a procedure that enables doctors and surgeons a way of executing complex surgeries. I chose the term accuracy because that is one focus robotic surgery has. Duration because robotic surgery has been said to not take as much time as traditional surgery. Traditional surgery is a type of surgery in which an incision is made using a scalpel. This is the most common type of surgery today. The last major key term I chose is minimally invasive because robotic surgery is categorized to be minimally invasive, and that entails minimizing surgical incisions to reduce trauma to the body. Some relevant literature. The most impacting literature I used for my research was provided from Mayo Clinic and the United States National Library of Medicine and National Institutes of Health. These references were provided to me and provided me with the most prominent information for my research. The details from these sources were very up-to-date and relevant, which is very important for my research because robotic surgery is a newer field of study. Mayo Clinic itself aided in a lot of background as well as definitions that allowed me to have a good foundation and basis for my study. The United States National Library of Medicine and National Institutes of Health gave me multiple studies of robotic surgery to compare and contrast for different outcomes and ailments of patients and surgeons themselves, too. Operative duration, estimated blood loss and complications, catheter time, hospital stay, return of continence, and overall healing were the largest focuses and main concerns throughout my research. To move on to my design study, the design study plan, which I'm going to execute my studies, will focus mainly on long-term patient outcome and future advances of robotic surgery. My study is an asynchronous satisfaction survey interview sent through email to patients regarding their postoperative surgery experience. The participants will be selected by obtaining permission from the healthcare facilities in 2 different regions to request from patients that agree to show their outcomes after receiving either traditional surgery or robotic surgery. The patient's information would, of course, remain confidential. I believe it is important to place a time cap on the survey so the researcher is able to execute the study in a timely fashion. The patients from the different facilities will have 2 months to complete the questions. I used this amount of time, so as a researcher, I'm able to gain multiple responses. The ideal response ratio would be 50 responses, half from traditional surgery patient experience and half from minimally invasive robotic surgery patient experience. The survey provided would include questions concerning surgery team at the facility, pain levels, recovery, comfort, restrictions, and medications. I will be using questions that are both quantitative and qualitative. There will be 6 total questions. The qualitative questions will be 1. My surgery team provided me with specific instructions for the most quality postoperative care. 2. My pain level was as expected and controllable. 3. An adequate amount of time was provided to me for my recovery at the facility. 4. Clinical staff contacted me at home concerning my progress, recovery, and comfort. 5. The correct medications were provided to me as well as adequate physical therapy needs in order to recover. The 1 quantitative question will be 6. My surgery only restricted me from day-to-day activities for a limited period of time. I would consider this type of research to be exploratory research. I say this because robotic surgery does not have too many extensive and design researches focused on it, especially in regard to patient outcome. My sample will include at least 50 patients, half receiving traditional surgery and half receiving robotic. I also chose 2 different healthcare facilities from 2 different regions, so the answers were not from all of the same generalized area. The participants would be one of 2 groups, the first group being the control group who received the traditional surgery, and the second group being the experimental group who received the robotic surgery. My data collection would be provided by a survey that would be received through a patient's email. I chose an asynchronous survey to allow patients time to formulate their thoughts about their surgery. The only downfall of this would be waiting for those responding. That would be a disadvantage, unfortunately. Next, the true purpose of this study is to discover if patients' robotic surgery have better outcomes compared to traditional surgery patients. The objective is aimed at robotic surgery being more optimal post-operatively. The expected outcome is for robotic surgery patients with minimally invasive procedures to be more satisfied post-operatively than traditional surgery patients. I say this because minimally invasive surgery is said to have better outcomes because it's less trespassing to the body. For my references, this completes my presentation. I included the references that help guide me through this project. Thank you for listening to my presentation. This was a very extensive process, but it provided me with a lot of details, data, and facts on robotic surgery. My favorite part was learning about the different healing processes, postoperative pain features, time spent for patients healing, and overall outcomes.